Hi guys, I'm Dr. Sunil Sharma. Now, my third video about surgical anatomy of neck, outside in approach. Okay, now there are three layers in the neck which cover the whole neck from inside outside: skin, superficial fascia, deep cervical fascia, that is also called fascia coli. It's having three layers: investing layer, pretracheal layer, and prevertebral layers. Okay, now talk about skin. This is formed by the epidermis and dermis. This skin, whole skin from superior occipital protuberance, external occipital protuberance to the this neck C7 spines. Okay, it's having four layers. Stratum lucidum is absent in neck also. Stratum basale, stratum granulosum, stratum spinosum, and stratum corneum. Here is lucidum that is absent here in the neck. Dermis is formed by the papillary dermis and reticular dermis. Papillary dermis is also called fingerprinting layer. Okay, and reticular dermis is also called tattooing layer. Where tattoo is lying, that is called tattooing layer. Okay, this all out. The skin is very thin and the skin is very lax. So you can modify the skin in surgeries and many surgical flaps. Okay, now this is all about the skin. Now we will talk about superficial fascia. Superficial fascia of the neck is morphologically derived from paniculus adiposus. You have seen lower mammals. There is neck bump like buffalo. That is morphologically derived from the paniculus adiposus. And face, which is derived from paniculus carnosa. That was single sheet of muscles which don't express any facial expression in the lower mammals. That is called paniculus carnosus, and face, which neck that is called paniculus adiposus. This superficial fascia of the neck is also called subcutaneous layer. Subcutaneous layer. This superficial fascia is also called subcutaneous layer because it contains subcutaneous tissue contain of superficial neck. Superficial cervical fascia is fat. Subcutaneous fat, platysma muscle. Platysma is thin neck muscle which extend from symphysis menti, submandibular lower border of mandible to the clavicle. Okay, this is platysma muscle and also contain superficial neck veins like intrajugular and external jugular veins also contained in the superficial. So superficial fascia neck contain fat, platysma, and superficial neck veins, and subcutaneous nerve and veins. Okay, these are the content of the superficial fascia of the neck. Now we will talk about deep cervical fascia and fascia coli, because this fascia coli forms the column. like it's cover whole encircle the neck. That's why it's called fascia uli, and it's having three layers. Investing layer, pretracheal layer, which upward extend about the head is pharyngobasilar fascia and buccopharyngeal fascia, also extension of the deep cervical fascia, and prevertebral layer is also deep layer, deepest layer of the deep cervical fascia, and it also forms carotid sheath. Carotid sheath sheath is also formed by the mainly by the prevertebral layer, and anterolateral and medial part also formed by the pretracheal layer. These about deep cervical fascia. Now we will talk about deep cervical fascia in detail. Deep cervical fascia. Now we will talk about first layer, investing layer. Investing layer of deep cervical fascia and circle from in front to the back. It extends from external occipital protuberance, superior nuchal line to back at the level of C7, spine of the C7 cervical vertebra, and laterally it external spine of the scapulae, acromion process, clavicle in front. So superiorly it attached at the superior nuchal line, occipital protuberance, and inferiorly attached to that clavicle and acromion process and the spine of the scapulae. So this is the extension of investing layer of deep cervical fascia. It also extend upward in the face that form the face here. It extend here, that is mustard process laterally, and extend here up to the zygomatic arch, which at zygomatic arch and behind at the preauricular region it form the parotid parotidomastoid fascia. Here it's covered the parotid, form the parotid capsule. That's why it's called parotidomastoid fascia. Normally deep fascia is absent over the face. That's why only it's present on the parotid mastoid fascia and buccinator. That layer is buccopharyngeal fascia is also present over the, that is middle layer of deep cervical fascia, which present over the buccinator, that is buccopharyngeal fascia. Okay, that is parotidomastoid fascia. Now this fascia also investing layer form another is stylomandibular ligament. This ligament extends from styloid process here up to the inner side of the mandible. That is also part of stylomandibular ligament, which divides the submandibular gland to the parotid glands. It in between this fascia is stylomandibular ligament. From the stylomandibular ligament, above this is the parotid gland, below it is submandibular gland. That is stylomandibular ligament. It pierced by the stylomandibular pierced by the external carotid artery. Also, you have to remember this point. This is very common MCQ. This divide the submandibular gland to the parotid gland. It extends from the stylomastoid foramen to inner side of the mandible. Now, below the nape, it forms the suprasternal space of buns. Okay, this investing layer here at the level of this supraesternal notch between this external head of two sternocleidomastoid muscles. Okay, it forms the supraesternal space of bulb, and between this external and clavicular heads form the supraclavicular space. Okay, two spaces, supraclavicular space and supraesternal space of bulb. This here one MCQ asks is which artery can be palpable on this space is palpable artery inferior thyroid artery. Okay, this is most common ask of MCQs. And content of this supraclavicular space is anterior jugular vein, fat, and loops of vein which connect the internal anterior jugular vein to external jugular vein. Okay, these are content of the supraesternal space of the lung. Same time, same here. Supraclavicular space contain the external jugular vein and external jugular vein and fat and some lymph, and mainly supraclavicular lung. These are the content of the supraclavicular space. Now, this investing layer, if you see this black line, investing layer cover the sternocleidomastoid. This is sternocleidomastoid muscle, and also cover the trapezius muscle. Okay, this cover the trapezius muscle in circle hole inside arm. Okay, and its anterolateral wall is of this carotid sheath. This carotid sheath formed by the investing layer of deep cervical fascia, and it also extend up to it's covered divided into two parts. Outside and cover the submandibular and parotid gland. Okay, this is all about investing layer. You can write about its cover submandibular gland and parotid gland. Okay, this is all about investing layer of deep cervical fascia. Extension, I already mentioned. Superiorly external occipital protuberance to superior local line. Inferiorly it attaches to acromial process. Laterally, spine of scapula laterally, and supraesternal and clavicle to supraesternal region. This is the extension of investing layer of deep cervical fascia. And anteriorly it attaches here. Symphysis menti, lower border of submandibular, mustard process, then superior local line, external occipital protuberance. Then this posteriorly attaches this ligamentum nucci at the spine of C7 vertebrae, and then laterally spine of scapulae, then come here clavicle. Okay, this is all about extension of investing layer of deep cervical fascia. Now we will talk about second layer. Second layer is pretracheal. Pretracheal layer having two parts. One is muscular part, another one is visceral part. Muscular part covers this green line showing the pretracheal layer of deep cervical fascia. Okay, so this muscular part covers the muscle that all inferior muscles. This is sternocleidomastoid muscle. This is sternothyroid muscle. Okay, this is all step muscle. There are four step muscle here from sternum to hyoid. That is sternohyoid muscle. Then deep to is sternothyroid, and above extension is sternothyroid, and one is muscle is omoid. So these are four muscle cover, four muscles. Sternothyroid infrared muscles. Infrared muscles. Sternothyroid, sternothyroid, thyroid, thyroid, and fourth one is omoid. This muscular layer of pretracheal fascia covers the sternohyoid, sternothyroid, thyroid, and omoid muscles. This visceral layer covers the trachea, esophagus, and thyroid. At the posterior border of thyroid and in front of cricoid cartilage, it forms the ligamentum berry. Ligamentum berry, which attaches thyroid to cricoid. Cricoid cartilage to thyroid attached. Sometimes may extend up to the thyroid cartilage, but mainly cricoid having firm attachment to the thyroid by this ligamentum berry, which surgically important you have to cut by sharp cut. Sharp cut during thyroidectomy surgery. Okay. All muscle, all most important point here, all infra-iron muscle MCP. All infra-iron muscle supplied by the cervical, ansa cervical. Ansa cervicalis, all except thyroid, which is supplied by separate branch of C1. Ventral lemma of C1, cervical vertebra, cervical plexus. C1 spinal element, which separately supply the thyroid. Rest of these muscles are supplied by the ansa cervicalis. Okay. Now, pretracheal fascia extend above the hyoid as a form of buccopharyngeal fascia outside the pharynx. This pharynx covered by outside is by buccopharyngeal fascia, muscle, pharyngobasilar fascia, and mucosa. Okay. So, this pretracheal area extend as a buccopharyngeal fascia, which also cover buccinator muscle here on the face, that is muscle of facial expression. Now, extension of this pretracheal layer of deep cervical fascia extend this hyoid bone to it also form in the superior mediastinum. It extension of pretracheal is extension from hyoid to fibrous pericardium. It extends from the hyoid bone here to in the thorax up to in the superior mediastinum and the fibrous pericardium formed by the pretracheal layer of deep cervical fascia. Now we will talk about deepest layer of deep cervical fascia is pre-vertebral fascia. This prevertebral fascia extends from skull base and nasopharyngeal part, the pharyngeal tubercle, skull base extend from skull base to T4 vertebrae at the level of T4. Extension superior axle skull base and the nasopharynx and in the thorax up to the T4 vertebrae. Okay. Now, this prevertebral fascia, also called prevertebral muscles. This is longus puli muscle and scalene muscles and this longus capitis anterior posterior. All muscle covered by this deep cervical fascia, that is prevertebral fascia. Here, it's divided into two parts. Okay. One fibrous sheet. Suppose this is the pharynx. This is buccopharyngeal fascia, and this vertebrae and this whole is this prevertebral muscle. Prevertebral muscle. Here, deep cervical fascia is whole in this is whole is deep cervical fascia, divided by one fibrous sheet, that is alar fascia. Alar fascia. This divided into two parts. This prevertebral space divided into two parts, alar fascia, and this is prevertebral space. Anterior to this is retropharyngeal space. And beyond this alar fascia is called danger space. Danger space. Because this danger space is having extension up to posterior mediastinum. Posterior mediastinum. Because any infection in the prevertebral space, especially in danger space, lead to any neck infection into the posterior mediastinum up to level of T4 vertebra. And this anterior to this alar fascia is retropharyngeal space. Here having retropharyngeal nodes, which may have access here. But this alar fascia is entirely attached at the lateral process of C7 span. That's why it's not going beyond this C7 vertebra. Okay. So, anterior to this retropharyngeal space may have extension up to the C7 vertebra, but this danger space may lead to infection in the posterior mediastinum. That's why it's called danger space. That's why it is extension to posterior mediastinum. This is prevertebral fascia. Okay. Now, this prevertebral fascia extends from skull base to T4 vertebrae. Now, important point is only two. One is danger space is called behind the alar fascia, and this retropharyngeal space this is alar fascia divided into posterior to alar fascia is danger space, anterior to alar fascia is retropharyngeal space. If you see any midline, okay, this is midline, any midline swelling abscess is always in the danger space because it's having extension from skull base to exactly in the midline to the T4 vertebrae. That's why it's a danger space. Any lateral swelling here is called retropharyngeal. This is the most common MCQ asked. Lateral extension having most retropharyngeal lymph node. That's why it's extension of the prevertebral cell, but it's laterally situated. Okay. Now we will talk about some important one like carotid. Carotid sheath is extension of prevertebral layer of deep cervical fascia, but some part of is also formed by this part is formed by the pretracheal layer, and some part of this is also formed by the investigator layer. If any MCQ is asked, this carotid sheath is formed by all layers, investing layer, pretracheal layer, and prevertebral layer, all form the carotid sheath. Now, content of carotid sheaths. This is carotid sheath. Medially, it is carotid artery, common carotid artery, or internal carotid artery. Okay. Behind this is vagus nerve and vein. One vein, very important vein is IVV, internal jugular vein. Here, in the wall of carotid sheath, you find this ansa cervicals. Yes. Okay. This is all about leg covering, that is super skin, superficial fascia, and deep cervical fascia. And next time we will talk about individual muscles of the neck, head and neck, and skull, all skull bones individually. Thank you so much.